Well, hello, friends. It's Dr. Missy Clifton here, and today we are talking about another one of my all-time passions. And you know, as the founding partner of Premier Dermatology and Aesthetics, skin and acne-free skin and healthy, glowing skin is my passion. We've already talked on a previous episode about kind of a whole body approach to hair health with our wonderful, lovely guest, Jocelyn Maddox, who is the Senior National Sales Director for Nutrafol. But today, we're going to talk about a new formulation from Nutrafol that is a whole body approach to treating acne. Hello, Jocelyn.
Hi. Thank you, Dr. Clifton. Thank you for having me today.
Welcome back.
Super excited to talk about, the newest addition to our portfolio at Nutrafol. So, Nutrafol is just committed to whole body health, and they also are committed to proving that these products actually work. And so I think that's the, key differentiator between Nutrafol and maybe some other, supplements that are out there.
I agree, 100%. The clinical studies are real, and they're numerous. For all of the hair supplements, that was one thing that years ago when we brought on this line that was so impressive to me. Because, if you sell supplements in the United States, you don't have to prove that they do anything.
That's right.
The vast majority of the junk on the shelves is just thrown in a bottle and packaged, to claim to do things, but they've never proven that it actually works, that it's actually even absorbed.
That's right.
So, and that's the thing. That's why I'm passionate about Nutrafol, because you guys do the work. You do the science. You prove that what's in the product is getting absorbed. You prove that you're going to get the results. And that's why I was super, super stoked that you guys are doing this acne formulation. And, again, acne it's a thing. It happens. It's not just a teenage thing. It's an adult thing. And it with hormonal changes, with especially women in their, menopausal area. I mean, I'm starting to have some acne bumps again. What the heck?
Yes.
I know. It's just, there's just no fairness. It continues to plague us throughout life. But, we do a lot of treatments for acne at Premier Dermatology and Aesthetics. There's antibiotics, there's topicals, there's even Accutane, which is the most powerful drug on the market. There's even laser devices now that work beautifully for acne. But, a lot of people can't afford the laser devices. A lot of people don't want to do the really, strong Accutane because they're worried about side effects. A lot of women, maybe young women especially, don't want to take birth control, and you actually have to really be careful to prevent pregnancy from that. And a lot of the antibiotics are just not safe for long-term use. So I love it, especially for patients that really want just a very natural approach, something that's going to be good for their body, not cause any kind of major side effects. That's why this supplement is very new and very different. So let's talk about it.
That's right.
Let's talk about it.
Dr. Clifton, all those things that you just talked about, topical, laser, it really looks at acne. It addresses acne locally. Mm-hmm. And so what Nutrafol sought out to do was to really look at acne systemically. And what are those key root drivers? Just like with, hair health, what are the key root drivers to skin health and to acne?
Right.
And what does that formulation look like? And so, through some of our clinical research with hair, some patients would come back and they would report to their dermatologist that their skin had also improved or that they had less acne. And so our scientists and our research team, they really started to look at what are those ingredients that address, those key root drivers, which stress, holy basil, right?
Holy basil.
Holy basil.
That is so funny to me. I love that holy basil. It's like it's part of the Holy Grail, right?
That's right. That's
Tell us about holy basil.
So holy basil is another adaptogen, similar to ashwagandha, that really addresses stress and helps. Of course, a lot of people experience acne when they're going through a stressful time.
Absolutely.
So we have that, and then we also have maca and selenium, which addresses, that hormone imbalance,
which is huge.
Yes,
acne.
Yes,
huge.
Yes, and berberine, which is a new ingredient that is there's a lot of buzz because of the GLP-1s. So
Take berberine every day.
That's right. So it really addresses, the glucose spikes, the metabolism piece of it. And then Sicilian orange, which sounds super yummy.
Delightful.
Yes. To address, the dark spots, the post-acne, dark spots.
So common, that post-inflammatory kind of hyperpigmentation. People think it's scarring, but thank God, usually it's not scarring. It's just a little pigment change there. But if we can get rid of that quicker, oh my goodness.
Yes.
It's a game changer for people.
Yes. And, this product can be used in combination with, patients on spironolactone or antibiotics or something like that. It's totally safe to use it with it. And, I think as somebody who has, suffered with acne, in my lifetime too, it's like the antibiotic may work for a little bit and then you have to, switch, or you have a chemical pill and it works for a little bit and then, you have to return and have it done again. So I do think this is something that just addresses those key root drivers that is a whole body health way to address acne.
That's amazing. And what people probably don't realize is that acne is so multifactorial.
Yes.
Okay. So we've mentioned hormones. Certainly hormones definitely play into acne. Stress, of course, plays into everything. Stress makes everything worse is what I usually say. But, interesting, sebum production. So oil production definitely is part of acne. The fact that the pores get clogged, like the skin doesn't exfoliate itself, so the pores get clogged, that oil gets trapped. Then there's bacteria that then get trapped in that, and that whole cycle is then fed by hormones and other things. So it's just this amazing cascade of multiple things that are causing it. And then, oddly enough, gut health, just like everything else we found, the gut is it's key to everything. If you don't have good gut health, you're going to be acne prone. The medications and things that you take orally are not going to work as well.
And that is the beautiful thing about this product. It actually has a prebiotic, a probiotic, and a postbiotic.
That is so amazing.
So address that gut health.
Let's talk about those three things.
Yes.
Okay, because a lot of people may not understand what that is. So we hear a lot about probiotics. So those are actually the active, the good, normal bacteria. So you're actually replacing the active bacteria in the gut.
That's correct.
Right.
And we have an acid-resistant capsule, which helps it get to where it needs to go, right? That's very important as well. And so I just think that, what our scientists realized is that we needed to address all of those things. And the gut health is definitely key.
That's a big part of it. And then so you replace the good bacteria, but then you have to feed the good bacteria so that they're happy. So that's the prebiotic.
That's right.
And then postbiotics are kind of a newer thing. Tell us a little bit about what the postbiotic does.
So the postbiotic really just sustains and helps keep that bacteria, healthy and leveled out at the appropriate levels. So it's just really comprehensive with all three of those.
I absolutely love that. So talk to us about, let's go through just the key ingredients that are in this amazing supplement, and we'll go from there and how they help, how each one of them kind of help.
Yeah, absolutely. So I would say also, most dermatologists, when we speak to them about the supplement, they are very familiar that zinc, niacin, selenium, folate, all of these, ingredients, they all help contribute to skin health and have been talked about for years.
Yeah, and that's another thing we didn't talk about. Most of those are kind of anti-inflammatory.
That's right.
And inflammation is a huge part of acne. The redness, the swelling, the pain, the erythema, the flushing and blushing that can sometimes happen, even especially if it's acne rosacea. So those are anti-inflammatory to a large degree. That's amazing.
That's right. And so what Nutrafol did with Nutrafol hair, they developed the Synergen complex, which were that key, ingredients that contributed or, that addressed all of the key root causes of hair thinning, shedding, hair health. And then they did the same thing with Nutrafol skin.
Okay.
They said, okay, what's the complex? So what's going to address all these key root causes? So, of course, we talked about holy basil for stress. We talked about maca for hormones. Curcumin, is another one that really addresses immune response.
Right.
And then berberine, of course, for, to address metabolism, and then Sicilian orange for the dark spots. So that's really the key ingredients. along with zinc, niacin, folate, selenium,
And vitamin A.
and vitamin A. Yes.
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 And so vitamin A is sort of key because
Yes.
it helps the skin to turn over. It's what's in Accutane.
Yes.
Now, Accutane is a very extremely high dose of vitamin A. But vitamin A is key because it does a lot of different things. It actually is what retinoids are a component. They're a compound, a vitamin A type compound. And retinoids help the skin turn over. They help to shrink the sebaceous gland.
Oh, yes. So we should talk about that too, because
That's a big deal.
in the studies, a lot of times what happens with, some topical, medications and things, it's very drying to the skin, right?
Right.
So you decrease that sebum production, but then you lose hydration. And what we found through the, clinical research is that actually over 70% of patients, they did decrease their sebum production, but over 70% of patients also saw an increase in hydration,
which is amazing.
huge. Yeah.
And it's the opposite of what happens with Accutane. The
That's right.
biggest side effects of Accutane are the chapped lips, the super dry, irritated skin, and very inflamed, skin. So that's amazing because you're getting that really powerful vitamin A, but you're also getting all of these anti-inflammatory and supplemental compounds that are helping the skin stay hydrated despite shrinking that oil gland, which is amazing. And then you're getting with the vitamin A, you're getting the skin turnover, which is preventing the clogged pores. And then all of these other supplements that are just making the skin quality so much better long term. So this is a supplement, for anyone that's acne prone at all.
That's right.
It's going to make their skin quality amazing, even if it's just very mild acne.
That's right. And just patients they're searching, they're looking, they definitely are looking for alternatives and for other options. And so this is just, either an alternative or another option, but can also be added on. I think it's very difficult sometimes to get complete clearing of the skin, everything, a magic wand, so to speak. And so this is just something that if you're just not getting the results that you want, this is something you can definitely add on to your current regimen for sure.
Yeah, and I have both of my teenagers on the supplement. They don't have horrible acne. They really don't, thank God.
Yes.
Which is amazing because both my ex-husband and myself had horrible acne growing up. So thankfully they got good genetics from us. They didn't get all of our bad stuff. Thank you, Jesus. But at any rate, so the kids, it's a great vitamin as well. It's good for their gut. It's good for their skin. It's good for their overall health, and it helps with acne. So it's just a huge win.
Yes.
And, a lot of my adult women patients are taking this along, like you said, with spironolactone or hormonal interventions. It's just something that I recommend for anyone that feels like they're a little bit acne prone because it's just going to be great for your skin overall.
Totally agree.
And another thing about vitamin A, why do women in their 40s and 50s use vitamin A or retinoids? Wrinkle prevention.
Yes.
Skin cancer prevention.
Yes.
Vitamin A is sort of a miracle vitamin. It does so many wonderful things. So this is something that people can be on very safely, very long term, without the potential side effects of some of the other acne medications out there. So I'm super, super impressed with this brand and with the science that you guys continue to bring to the market. So thank you for the brainiacs over at Nutrafol. Thank you all for helping us and partnering with us and helping to educate our staff and our patients because it's a game changer for people.
That's right.
It's really important.
That's right.
So listeners, thank you so much for tuning in today. If you have any issues with acne, this new Nutrafol brand of acne supplement is something you really need to look into. So please come in and chat with us about it. It's also available on our website, on our store. So shoppremierderm.net. Is that right? Okay, yes, it is. It is actually not. It is shoppremierderm.com.
Oh, okay.
Okay. So you can find it there. Come in. We would love to talk to you about your regimen to really get your skin super healthy as well as acne-free. And Jocelyn, thank you again for joining me.
Thank you, Dr. Clifton, for having me. Always a pleasure. Very honored to be here. Thank you.
We'll come back soon. And friends, thank you again for tuning in. And we will talk to you next time on another episode of All Things Skin.